So in answer to the question about, how do centers respond? What do they do? How do you decide as a center which less invasive approach should I use? Should you, for instance, if there's 3 different ways of doing something, should you learn how to do all 3? Usually in quality improvement literature and in quality improvement practice, you really want to reduce variation in practice. The way to reduce variation in practice is for a center to develop 1 or 2 approaches that they do well, that everybody does the same, that everyone supports. So my recommendation and the practice that we used, at the unit that I practiced most of the last 20 years at, was to try to say, well, what looks like the best evidence? Let's talk about it and find out what everybody would agree to, and then let's educate the staff, including the nurses, the respiratory therapists, all the staff, and then let's agree that we're going to now make this change in practice. Let's look at how we do. So start the practice, get a baseline set of data, like how are we doing? Start the practice, measure what you're doing, and if you're showing improvement, then stay with that therapy and hold those gains. That's sort of the essence of quality improvement intervention. So yeah, I think it's much better for centers to find 1 or 2 approaches at most for most of these non-invasive strategies and get good at that approach, because it means not only the physician making the decision, the nurses giving the care, the respiratory care practitioners providing support for the baby. Everybody, if you do that, knows what to expect. And somebody doesn't come along at 3 o'clock in the morning and go like, I don't really like this. We're going to change. That creates chaos. So that would be sort of a shorter answer to a long question.